So good afternoon. Thank you so much for having me today. My name is Eliza Morrison. I am the Director of Harm Reduction Services at the ACE Support Group of Cape Cod. You may or may not be familiar with our organization, but we have been on Cape for over 40 years now. We serve Provincetown. We have a brick and mortar site in Provincetown, which serves all these outer Cape towns, and then we also have a brick and mortar site in Hyannis and a mobile unit that operates to serve the upper Cape areas. We also have a site on Martha's Vineyard that we share with Health Imperatives. Part of what we do is we have focused over the past few years on stemming some of the harms that can be associated with opiate use and the opiate epidemic. So we provide testing services for folks who potentially could have been exposed to virus, soft tissue infection, etc. as a result of injection substance use. We also work to educate the public in how to recognize an overdose and how to access and how to use Narcan. And we want to thank the town of Eastham for being one of the first towns on Cape to install nalox boxes, which are boxes that you will probably start seeing in the community. They hang on a wall, just like an AED, and they house about 3 to 4 boxes of Narcan. They are free and available to the public. It's a great way to get Narcan into a higher risk community, and also a great way to reduce some of the stigma that's associated with substance use and also with carrying Narcan.
Eliza, can I jump in just to let folks know that we currently have the boxes, one at the library and one at the police station, and we do also have some Narcan available at our office in the health department.
There is a law in Massachusetts called the Good Samaritan Law, which protects anybody who carries Narcan or uses Narcan to respond to what they believe to be an opiate overdose, responding to the best of their ability and the best of their comfortability. It is perfectly legal to carry Massachusetts and Narcan in the state of Massachusetts. There is a standing prescription for every individual who lives here. It is safe to carry, it's safe to have around kids, it's safe to have around pets. If you use it on somebody who you believe is experiencing an overdose and they do not have opiates in their system, there will be absolutely no adverse side effects. This is a very, very safe thing to feel confident carrying. And as a community member, it's a really, really great way to keep people safe and potentially save a life. As we know, a lot of overdose happen in public spaces because sometimes people who use substances don't have safe spaces or spaces they feel safe using substances in. So we'll see overdose in public spaces like beaches, beach bathrooms, parks, bathrooms in rest areas, etc. So if you are carrying Narcan, you are prepared to respond in that situation. So today what we're going to do is just talk a little bit about how to recognize an overdose, how to respond to an overdose, and how to use Narcan. So before we learn how to use Narcan, we just have to know what it works on. So Narcan is the antidote to an opiate overdose. It works to reverse the effects of an opiate overdose, and that is the only thing it works on. So what we're seeing a lot lately is a trend of substances being contaminated with fentanyl. So we've seen accidental overdose when folks are using drugs that they don't necessarily identify might have opiates on them. So sometimes if someone uses cocaine, it might be laced with fentanyl. If somebody uses cocaine that is laced with fentanyl, and you use Narcan on that individual, it will not reverse the effects of the cocaine, but it will reverse the opiate overdose. So it works on opiates, only opiates. What are opiates? So we have prescription opiates, so those are things like Percocet, oxycodone, Vicodin, things that would be prescribed by a doctor. And then we have our manufactured or illicit substances. So that would be heroin, fentanyl, and any other fentanyl analogs, which is just anything created to mimic the effects of an opiate. There are over 60 different fentanyl analogs here in Massachusetts right now that we've tested for. They all vary in potency, so it's really a mixed, it really is a mixed bag of substance out there. So really no quality control as far as potency of substance goes when it comes to fentanyl. Another thing that we're seeing, which is really alarming, is a spike in overdose in the 15 to 25-year-old age group. And this tells us that a lot of folks who are probably using substances for the first time are experiencing overdose. We know that there are a lot of pills out there that are being sold as things like Xanax, Adderall, Percocet. They're just pressed pills made to look like their prescription counterparts. What they are is filler and fentanyl. So people who are what we call opiate naive are experiencing overdose when they're using these different pills that they're purchasing from friends or whoever. So we now know what does Narcan work on. Now we'll talk about how to recognize an opiate overdose. So there is a difference between overdose and over-medication. So somebody who's over-medicated or just has too much substance in their system, you might encounter them, they might look like they're kind of nodding out. They might look really sleepy, they might be hard to rouse, their breathing might be a little bit labored, they look like they're doing what we call nodding out. These folks usually, if you start to engage with them, if you put your hand on their shoulder, if you call to them, they respond a little bit. With folks like this, we always, of course, want to call 911 and monitor them. These are not folks that we have to give Narcan to just yet. So call 911, stimulate, and observe. Obviously, if this progresses into something that we identify as an overdose, we would want to go ahead and administer Narcan. An overdose usually appears as somebody who is unconscious. You will hear a very typical type of breathing if the person is breathing at all. The breathing that you'll hear is a constricted breath at the back of the throat. Sounds rattly. This is because fentanyl makes the muscles in the chest and throat very tight, and it's hard for people to breathe and open that passageway. If you can see someone's eyeballs, they will probably look like pinpoint pupils. That is a hallmark sign of opiate use. They may have a faint or thready pulse if you can feel the pulse. I always tell people, look for the clues, look for your context clues. Opiate overdose, fentanyl specifically, happens within minutes to seconds after using a substance. So most likely, if you are encountering somebody who's experiencing an overdose, there will be clues that you'll be able to see. You might see a syringe, you might see some powder, you might see drugs somewhere. So those are all things that we should look for. People might be bluish, grayish around the mouth or in the fingertips. That's like a lack of oxygen. So we're looking for all of these things. The person might be completely unconscious. They might be able to kind of nod or respond to you a little bit. So when we identify that somebody is potentially experiencing an overdose, the first thing that we're going to do is we're going to call 911 or call to somebody to call 911. And then we're going to go ahead and we're going to administer Narcan. Now you can administer Narcan in either nostril. If somebody has had a fall, they could potentially have a bloody nose. We always want to use the nostril that appears the most accessible. If the person's nose is blocked up, use the Narcan anyway. That spray will access those mucous membranes and it will begin working within 3 to 5 minutes. So when in doubt, go ahead and use that spray. If the person has substance on their mouth or on their face, you cannot experience an overdose if you touch a substance. So touching fentanyl will not cause you to experience an overdose. For fentanyl to be absorbed through the skin, it actually has to be compounded specifically to absorb into that dermal layer. So if you're touching it, you are not going to experience an overdose. Obviously, you don't want to put your mouth on somebody if you're thinking about doing rescue breathing. You don't want to put your mouth on somebody who has a powder or a substance around their mouth. You would want to be careful because it does absorb through those mucous membranes. Touching with fingers, okay. If there are gloves accessible in the Narcan kit that's nearby, that's even better. So we're calling 911, we're calling out to somebody to call 911, and then we're going to go ahead and we're going to administer our first dose of Narcan. So the way we do that is peel, place, and press. So a box of Narcan comes with 2 single-step doses. These doses are one and done, so once you discharge it, you will not be able to use it again. So in a high acuity situation like overdose response, we would want to make sure that we're being really careful opening these packages and we're not kind of depressing this toggle switch on here. So we're going to peel the back off. You're going to go ahead and you're just going to dump it into your hand here. Looks just like a nasal spray. If you've given Flonase, you can give Narcan. If you've ever used a nasal spray, you can give Narcan. It is super simple. So you're going to peel the back off. You're going to place, and when I say place, you're going to go ahead and you're going to insert it into the nostril until the bottom of the nostril touches the tops of your fingers here. So now we have this nozzle in the individual's nostril, and then we're going to press. And you just press, and that's one and done. And there is a little spring load in here, so it can't be used again. You've given your first dose of Narcan. When paramedics show up, sometimes, especially in areas that are more rural, sometimes if the person starts to come back around, they actually will leave the scene. They can do that. You give your best description to the folks who respond. And you want to make sure that you leave the Narcan that you've used with the individual or at the site. So that way, if you have to back up when 911 comes in, you want to make sure that they know this person has had 1 dose of Narcan, 2 doses of Narcan, whatever. Or if the individual leaves the scene, we want to make sure that somebody there can account for how many doses have been administered. That's important for first responders and how they respond to the individual. So peel, place, press, so we've administered that first dose. Now, when we're responding and the individual is not breathing, we're responding to the best of our comfortability and our ability. If you are well-versed or comfortable doing CPR, you can go ahead and you can start CPR on that individual. Because what happens during an overdose is that the respiratory system is instantly depressed, we really want to focus on respirations. So it's not necessary to do chest compressions. What we advocate for is rescue breathing. If you have a mouth shield, if there's a mouth shield available on site, or if you are comfortable doing rescue breathing using either your hand, like this as a barrier over the person's mouth, you can pull a shirt over, you can use a piece of their clothing as well. If you're comfortable doing that, then you would go ahead and you would start rescue breathing. If the individual is not breathing and you're starting rescue breathing after you've administered that first dose of Narcan, what you're going to do is you're going to pinch the nostrils. You're going to tip the person's head back. So what that does is it blocks off the nostrils. It keeps air from escaping anywhere than going into the lungs. So what we're trying to do is we're trying to breathe for the individual. So we're opening up that airway, closing off that nasal passage, then we're putting our mouth over the person's mouth, and we're doing 1 good breath, pulling away, counting to 5, then coming back in with another breath. We're looking for a chest to rise. Sometimes with those tight chest muscles, constricted muscles in the throat, it's hard to see the chest start rising, but we're going to do the best we can. You are making a difference when you are doing rescue breathing. So we're going to go ahead and we're going to do 1 breath every 5 seconds. You're going to do that for about 2 minutes. Narcan starts to work in about 2 to 3 minutes generally. So after about 2 minutes of rescue breathing, we're going to do a reassessment on the individual. If you've done rescue breathing, we're looking for perhaps some intermittent breaths, some attempts to breathe, maybe a little bit of coughing, maybe some eyes are fluttering, maybe the person starts to try to speak, maybe hands are moving a little bit, anything that shows us that the person is starting to come back around. If you decide you are not comfortable doing rescue breathing or you don't know how, then we're just going to wait that 2-minute time period again, and we're going to reassess. We're going to do the same thing. We're going to look, are they starting to show any signs that they're coming around a little bit? If the answer is no in either one of those scenarios, you're going to go ahead and you're going to give another dose of Narcan. So you will give a second dose. You can give it in the same nostril, you can give it in the other nostril. Either one is okay. Any questions about that? Super. Okay. So now we've given 1 dose of Narcan. We've determined maybe we do or we don't have to give another dose. If you do give another dose of Narcan, that same cycle would start again. If they are not breathing, we continue with that rescue breathing for about 2 to 3 minutes. We reassess. So we're basically just waiting for 911 to come. If you are not doing the breathing, you're just waiting with the individual. You're kind of talking through it, and we're waiting for that Narcan to start working. We're waiting for that response. In my experience, it generally does take more than one dose to get somebody breathing and kind of alert-ish again. Again, that is dependent on their tolerance, any medical conditions they may have, and also the substance that they've used. So there are a lot of factors. When people do start to come back around, what we want to do is we want to make sure that we get them into what we call the recovery position, which is just assisting somebody onto their side. We do this for a couple of reasons. Number one, it can be a really jarring experience to kind of come to with, potentially bystanders, rescue, etc., standing around you. This is when we see situations where people will up and leave because they're scared. Sometimes folks will lash out because they're disoriented, they're anxious, they're confused. That's not because of the Narcan, it's because one moment they're using a substance, everything is fine, then the next moment they're coming to and they're not feeling well, they're scared, the situation is unfamiliar to them. So we want to get people on their side, reassure them that the effects of the Narcan are going to wear off. By effects of Narcan, I mean Narcan puts people into what we call precipitated withdrawal. So when you give someone Narcan, you are knocking that opioid off of the receptor. People will immediately start experiencing withdrawal symptoms. Those can include like sweatiness, sneezing, dizziness, sometimes vomiting, feelings of restlessness, hot flushes. So we want to make sure if anybody actually does vomit that they are on their side, because it's the safest way to keep people from aspirating. And we just stay with folks until help arrives, and then you report the best you can. When people get there, report how you found the person, report the circumstances. Narcan works the same every single time. People's response to Narcan depends a lot on the substance that they've used, how long have they been in that overdose state, did they fall down in the bathroom and you heard them fall down and we're encountering them immediately after an overdose, or did you walk in to use the restroom and potentially they've been in there for a little bit. So how they respond to Narcan is really dependent on a lot of circumstances. People with underlying health conditions, etc., don't process substances the same in their systems, so may be at higher risk for overdose and less able to kind of like bounce back after having a dose of Narcan. Does everybody feel comfortable with that? Okay, yeah. And like I said, the Good Samaritan Law in Massachusetts protects anybody who uses Narcan during an overdose, witnesses, etc. So you can feel totally safe and confident administering Narcan. If you do decide to carry Narcan, storage is important, but it's not the most important thing. They really tell you that they'd like it to be sort of in a more climate-controlled environment, no extreme fluctuation of temperature, either cold or hot in either direction. I tell people it doesn't do you any good if it's in your kitchen cabinet at home and you are at Cumberland Farms responding to an overdose. Keep it where you can get it. Keep it where you will use it. Replace it more often if you need to. It does have a couple years expiration date, but if yours does experience fluctuations in temperature, replace it a little bit more often. We will replace it at any of our sites, or you can go to a Nalox box and you can grab it free of charge. If your Narcan is expired, or if your Narcan has been exposed to extreme temps, use it anyway. If that's what you have, use it anyway. It does retain most of its potency, so you can feel pretty confident that it will still be effective. Let's see, what else? I guess that's it. If you ever do use Narcan in the community to respond to an overdose, if you want to call us, we do have stickers on these boxes. There will be information on the Nalox boxes as well. and you want to provide us with an either report back with your name or a totally anonymous report back, that information is really, really valuable to us serving communities. If we suddenly start getting a lot of reports in Orleans or Dennis, or we know like, okay, this is a community that potentially needs a little bit more training. Maybe we need to get some more Narcan out there. Maybe we need to start asking our participants, have you experienced, any especially strong substances? Is there anything unique about the substances that are in this area currently? We also communicate with EMS and police departments we work with a lot to kind of alert them to different substance trends in the area, especially with the contaminated substance supply that we are currently seeing. So we help them a lot with their post-overdose response and kind of sharing community information because we are working with people who are using substances every day, and they are kind of our best resource for that type of information. So our organization, like I said, we are a harm reduction-based organization. We don't require that anybody be abstinent to use any of our services. So we do provide harm reduction materials to folks. We have things like fentanyl test strip kits. These can be used to test substances that people think could potentially be contaminated with fentanyl so that they can make an informed decision when they are using substances. There's a lot of parents that are actually keeping these in their homes now because, kids, we're tracking that as a pretty high-risk kind of demographic right now for accidental overdose. So we have stuff like this at all of our sites. Bring Narcan if anybody's interested. So, yeah, any questions?
I have one. Is there any lower age limit, for babies or something like that?
No. So if there are no opiates in an individual's system, we've had instances of, dogs getting into people's Narcan, kids spraying. The great thing about Narcan is it only does exactly what it's supposed to do. So it is really safe to have, Yeah. Good question. All right, everyone. Do you guys want me to leave a box of Narcan here today and folks can take it if they want?
Absolutely.
Yeah, so I'm going to leave a box of Narcan here on this table. Everybody who wants to carry a box, feel free to grab it and communicate with us if you ever need more or know anybody in your sphere that could benefit from having it at their home.
I have a question.
Yeah, sure.
What's the name of the group that you're with?
Sure, the AIDS support group of Cape Cod.
AIDS support group?
Yep. Yeah.
Thank you.
Yeah, and you'll be seeing our mobile unit around starting next week. And we will be doing kind of like on-the-spot Narcan training and education in the Outer Cape communities as well. So